Hi, I'm Dr. Shikha Sharma, and today we are going to be starting a series on how to protect yourself from cancer and what exactly is cancer, because these things are very important for you to understand at the base level if you really want to protect yourself from cancer. So, the first thing which you have to understand is that if you want to protect yourself from cancer, it is very much possible because cancer has a deep linkage with your nutrition and with your lifestyle. And if you change your nutrition and lifestyle, you can immensely, radically reduce the risk of cancer happening in your body. But first, you should know what are the risk factors and what you can do to reduce the risk of cancer. So, first thing we have to understand that in our grandparents' generation, very few people had cancer. We used to hear this big word occasionally, rarely. And in your immediate family or friends, nobody had cancer. You used to hear about somebody having cancer. There was a movie where you would see that, oh, the actor has cancer and it's like a big deal. And it meant death. That means once you had it, you were gone. Today, both things are happening. First thing is a lot more people are getting cancer. Everybody has somebody in their family or friends who has been diagnosed with cancer. Everybody. There's nobody who doesn't have a family or friend who has not been diagnosed with cancer. Number one. That means it's so rampant. Number two, cancer does not mean death. People have been living a healthy, good life despite having cancer. But also, now that more and more studies and research has been done on cancer, the best thing which has been found out is that cancer is a lifestyle disorder. Till now, the lifestyle disorders we would talk about was heart attack, diabetes, cholesterol, asthma, obesity. But now even cancer has been called a lifestyle disorder, which means if it is lifestyle, that means it is coming from our own eating habits and our own living habits, which means we can change it. That means we can change and protect ourselves from this deadly disease, which is coming in a very big way and affecting so many people. So now let's understand that in these series, which we'll keep having regularly, what are we going to be talking about? We're going to be talking about obviously what are the risk factors which lead to cancer. We are going to be talking about what are the early protective screening tests which you can do so that you are warned in time as the risk is increasing in your body. It's like, like a thermometer, like a temperature. As the risk is increasing, you know, and you can take corrective action. You don't have to wait till the end to actually get the disease before you take action. So, what is the difference between a blood test to diagnose cancer and a screening test to see the probability of cancer? So, these two things are totally different. Please remember. The first is a screening test to see the rise in probability of getting cancer. That means you don't have it now, but the blood cells are changing, the tissue cells are changing a little bit, which shows that if you continue the way you're continuing, you can get it in the future. That means the load is increasing. The signs are coming in the blood that something is not right, but you still don't have cancer. It is just the early screening which is telling that something is wrong. The second is that people have got the disease, people have got cancer, and the blood test is showing cancer positive. Now, between these two, there is almost 5 to 10 years gap. That means you have that much time to actually change your habits, your health, your feed, your nutrition, so that you don't go from here to here. It's like, let's say, diabetes. Now, in diabetes, early subclinical diabetes happens when you see that there's once or twice there is a spike in blood sugar, or the blood sugar doesn't come down naturally, it comes down very slowly. That means you don't have diabetes. Nobody can call that you're diabetic, but it's not perfect, like blood pressure. It's not that overnight anybody gets blood pressure. What happens that when you do an activity, your BP rises, but it falls. But in people who are developing blood pressure, the blood pressure rises but doesn't fall enough or enough fast. So, that curve changes. So, what I'm trying to say is that all diseases, before they become solidified in your body, before they become prevalent in your body or present in your body, initially they just give you some sparks, some clues that look, we might come, we might come, we might come. And if at that stage you change things in your body, in your health, in your diet, in your nutrition, in your lifestyle, then they won't come. So that's the way it is. It's like almost the weather, that it can forewarn you, and you can change situations, you can change things rather than keep waiting for it to happen. So that is a screening test. It is a screening test which can actually help you change your or course correct. It's like traffic, like you get a traffic advisory that, okay, 2 kilometers down the road there's a traffic jam, avoid that road. So what do? You change the direction of your car and you just avoid the traffic jam. But if that warning had not come that there is a traffic jam ahead, you would just drive straight into the traffic and get stuck there for hours and hours and hours and get late. Similarly, a screening test tells you that, look, there is something which is not perfect in your body, you need to make changes. But you don't have cancer, but things are not looking good. And then, of course, after 5-10 years, there is cancer cells which have come up, which are detected in your blood. So these two situations are totally different. So a screening test will not diagnose cancer, but it will tell you that your things are not looking right, your enzymes are not looking right. In future means 5 years, 10 years. If you continue with what you're eating and how you are living, you may get it. So that is very important. What else we'll be talking about in these videos? We'll be talking about, of course, risks. We'll also be talking about how to reduce the risk. Nutrition, breath work, exercise, stress management, perfumes, room sprays, antibiotics, painkillers, tobacco. I mean, everything we'll talk about. And why I'm saying antibiotic and painkillers? Because a lot of people misuse medications. Misuse. Not recommended by the doctor, not recommended or allowed, but they are just using by themselves. So they are insulting their body by attacking it by chemicals which they don't need. So we'll talk about those things also. So what we are trying to do is we are trying to actually put the power in your hands to, as far as possible, disallow cancer from coming into your life. So again, I'll repeat, we are trying to put the power in your hands to, as far as possible, disallow cancer from entering your life so that you stay safe, because you are forewarned and forearmed. So in today's video, we're going to be talking about why is cancer rising. Firstly, why is cancer rising? Now, there are no simple answers as such because it's multifactorial, multi-pronged. But if you ask me what is the greatest problem happening, it is the rise of chemicals. So many chemicals, continuously flooded with chemicals. And that is why when our bodies are getting attacked by so many chemicals outside, inside the body's very delicate enzyme systems very sophisticated biofeedback systems, hormone systems, recovery systems, healing systems are getting, I won't say destroyed, it's a strong word, but really harmed. It's really harming our all these systems with recovery, regeneration, healing, protection, immunity, all is getting affected because of this onslaught of chemicals. Now I mean, of course, everybody knows air, water, and food, but do you know that even the chemical perfumes you're using, you're not using natural room sprays, chemical room sprays, chemical pest control. So much chemical we are using today. Why are we using so much chemical? Because we're not living life mindfully. So much plastic we are using, plastic tiffin boxes, plastic water bottles, plastic storage containers, plastic oil containers. Why do we use plastic oil containers? We are getting microplastics in our body. We can definitely change that. So it is not that everything is only air, water, food. A lot of it is also the choices we are making every day in our lives. And that is why those choices need to be changed now before we end up with a cancerous lesion. We'll also be talking about, of course, that what are the diagnostic methods, what are the cells, everything we'll talk about. But first, we'll talk about prevention, protection, and shielding from onco disorders or cancer disorders. We'll talk about prevention, protection, shielding, risk reduction, risk mitigation. Then we'll talk about management. And then we'll talk about not only primary prevention, that is, you don't get it, but also secondary prevention, that in case you have got it, you have got the treatment. Now, how to ensure that you don't end up with a relapse. What is the kind of food you should have? What is the kind of oil you should have? What is the kind of vegetables you have? What are the kind of things you should have in your lifestyle? What does it have? What is the kind of breath work you should do? What is the kind of meditation you should do? What is the kind of uh, chemicals or no chemicals you should use in your daily life? Not only food, but like I said, it could be perfumes, it could be aroma, it could be pest control, it could be sanitizers, it could be so many other things which we do without realizing. It could be storing oil in bottles. Which kind of bottles are you storing your oil? Which kind of the milk which you store? What kind of container are you storing your milk? Achar, all these things. How are you storing it? How are you keeping it? So all this we'll be talking in these episodes. So do watch out, because from the next episode onwards, we'll be talking about the beginning of understanding cancer, and then slowly moving into preventing and managing and preventing relapse. So join me in all these sessions, because we'll be ensuring that you become uh, educated about this disease, so that you are not taken for a ride, and also you can protect yourself and your family. So keep watching.